Hello, and welcome to Health and Fitness Redefined. I'm your host, Anthony Amen. Join me today as we take a dive into the world of health and fitness. We're learning how to overcome adversity, depict fact versus fiction, and see health and fitness in a whole new light. Guys, we are 3 weeks in talking about this. Our online training program is live. I highly recommend you go check it out. www.redefined-fitness.com. Whether you're looking to get back into the gym, to track your workouts, to hit new PRs, to work on powerlifting, to work on strength, to work on weight loss. This all-encompassing app that we designed for you guys will help us get you onto the next level, or maybe it's even getting into the gym, or maybe it's those small-scale victories that we work on in our in-studio that we're now branching out all over. Maybe you want to learn how to ride your bike again. Maybe you have some things in your life you need to help get over. I highly recommend checking out that online training program. It's all on our website, www.redefined-fitness.com. Without further ado, let's hop into today's episode. For all my female listeners out there, we're going to have a jam-pack. Don't worry, guys. We'll also have some really cool information for you, too. We have a great guest. She's coming all the way from Seattle onto our show, Dr. Karlie. Dr. Karlie, how's it going today?
I'm great. Thanks for having me on today.
Absolute pleasure. For those that do not know, she is a doctor of chiropractic medicine, and we are excited to have her on. I personally love having chiropractors on because you guys are more in that holistic realm, kind of steering away from just prescribing medicine all the time. I'm personally a huge fan of that, and a big shout out to, I know if any doctor of osteopathic medicine doctors listening, you shout out there too, always. But without further ado, just want to explain to us why you got into the chiropractic field in the first place.
Yeah, thanks. Well, my history with chiropractic goes back quite a ways. I've seen a chiropractor since I was a baby, actually. My mom had a pretty severe scoliosis, so she wanted to just get us in as little babies to get checked out and just kind of make sure that our spines were moving well. And I saw that chiropractor all the way through high school, through college, playing collegiate volleyball. Every time I'd go back home, I'd make sure to get into him. And as I was looking to what I wanted to do as a profession, I started to learn about the field of sports chiropractic, which is a little bit different than traditional chiropractors. We mix more of like physical therapy modalities, chiropractic, personal training, athletic training, kind of massage all into one treatment plan. And so that seemed like a really good fit for what I wanted to do and a way to help people, get people to move better, make them stronger, healthier, and seemed like a great fit for me. So there I went off to chiropractic school.
That's awesome. How long have you been doing it now for?
This is, let's see, I graduated in 2010. So I think this will be my 12th year in practice. And I sort of did it backwards. I finished my doctorate, and then I also did a master's in human biology. So I stuck around my school, I finished that, and worked with some high school teams that we were working in the training room with. So yeah, it was a long road, but it was definitely worth it. So
I loved what you mentioned. By the way, you do an all-encompassing program for massage, personal training, so it's an all-inclusive approach.
mhm.
What helps stem that idea as opposed to just, hey, kind of we can fix everything in office?
Yeah, I mean, I think if you understand the human body, then it makes sense, like the joints are connected to the bones and the ligaments and the muscles and everything works together. So I don't think you can really just look at the bones and the joints and not address everything else. And then if you're going to address everything else, you're going to work on someone's trap, you're going to work on their scalene, let's say you're going to work on, the muscles of the neck and the shoulder perhaps. Well, then you better give them some exercises to do to help them move better, feel better, kind of take care of it on their own so that they're not just constantly coming back for the same issue. So we always kind of joke that my practice in Seattle is called Seattle Sports Chiropractic. We always kind of joke that, we don't want to keep seeing you over and over for the rest of your life. We want you to get better and go out and tell everyone how quickly you got better, and and then we'll see you again down the road if you screw something else up,
I like that approach though, because that's kind of the same thing that we get as trainers. We have a
Yeah.
stigmatism that we don't want to teach people. So, because then we'll have a client for life. And I totally disagree with that. I'm
Yeah.
with you. I'd rather get you moving, teach you everything I know, maybe teach you more than I know by just having you steering
Mhm.
in the right direction. So then you can do it on your own. And then all I really want is, that will come back double. So that's a big
Yeah.
perk you get with a lot of people. And I do absolutely love that you guys do this. I know there's a lot of a stigma to chiropractors. There's two big ones. And I think one of them is a lot of people tend to think, hey, they're going in, they're doing the same manipulation techniques on my cervical and my thoracic and my lumbar spine. And then that's supposed to heal every condition I have. Can you walk us
Mhm.
through that a little bit and maybe debunk that stigma a little bit?
Yeah, well, I always try to recommend that people look for a chiropractor that has some additional certifications. So, usually a sports chiropractor is who I recommend they look for, just because that person is going to be looking more, like I mentioned, at the whole person, all the pieces that are encompassed there. So it's much less like get in, get cracked, get out sort of thing, come back for the rest of your life. And it's more of like, here's your treatment plan, here's your diagnosis, here's what's actually going on. You want to make sure they're always getting an answer of like, okay, what's wrong with me? And then what's the plan? You always want a plan. And that's going to change, right? Treatment plans change for every sort of doctor, even personal trainers, you make a plan and then it's like, oh, wait, you're better sooner, or maybe we need to extend the plan a little bit longer, or whatever the case is. So that's usually what I recommend people do, to sort of avoid that, just like going in, getting maybe the a similar treatment to a lot of other people, and just making sure that you're getting something that's tailored to you.
Yeah, it's really important to kind of take a whole body approach to how you guys are kind of doing everything. And I've personally been to a few chiropractors myself that I'm just like, but that's also personal trainers in my industry. So it's every industry. You're always going to have
Yeah,
good, bad, ugly.
totally. Yeah, there's people in every industry that aren't awesome at their job, and so that's why I always say, like, don't just go to the doc down the street, like, do a little research, look for a sports chiropractor. There's a lot of good ones actually in New York and New Jersey, and that seems to be a better fit.
Yeah, and I want to talk a little bit about OMM. I'm totally transparency. My whole family's DOs.
Yeah, yeah,
So I hear it every day, but I know a lot to do with muscle energy and warming up techniques. And then you guys do things as far as stim goes before you go ahead and actually move into the manipulation. Well, some people just do manipulation. Do you think you need the warming up of the muscles before you go into the actual technique or not? What's your opinion on that?
I mean, my personal opinion is usually yes. Of course, every person depends, just like in every profession dealing with humans, right? It depends is the answer. But I think with adjusting, yeah, for me, it normally goes better if we can get in, it makes sense, loosen up the muscles a little bit in whatever way the person tolerates it best. And then it makes the joints move a little easier. Another thing is that it shouldn't hurt to be adjusted. So if it hurts, that could be because the muscles and everything around it are so tight. So, okay, you take 5 or 10 minutes and you loosen things up or warm them up, however that looks, and then do an adjustment. Well, then maybe it goes better. Maybe it doesn't hurt, and people aren't going to guard as much. That's the thing, is if they're guarding, it's harder for us to adjust and to actually move the joints, but B, it might hurt a little bit. So I think if you warm things up, get things loosened up, it usually goes so much smoother and people have a much better outcome. So for me, the answer is usually it's better, but for some people, it's maybe fine to just get in there and get a quick adjustment. It depends for everyone. So
Love that answer. And I'm going to ask you the question you probably get from every single client ever is why do you hear a popping noise? What is that?
Yeah, so it's just some gas being released from the joint. And we always say like, don't focus on the crack. It's not all about the pop, things move without having loud pops and clicks and all that sort of thing. But sometimes you hear it and some people get really focused on it, right? Like they're like, oh, it didn't crack. And I'm like, yeah, man, but like I'm palpating your spine and I can feel that things have shifted and moved, so it doesn't always have to crack. That's my word of advice. It doesn't always have to pop.
I love that. It's because it's totally true. I just the pop though, the sensation that of that with the actual feeling your joints kind of relax, just the noise just adds to
Yeah, yeah, and you get a
it.
little, you get sort of a little, like, endorphin high from that too, but it's not necessary to feel better and move better, so
I'm gonna ask you to kind of pop into the second stigma, then we'll get into like the meat and potatoes of what we're gonna talk to, and that is schooling for you guys. And you kind of answered it pre a little bit, how you look for ones with separate degrees, but do you think a lot has to do with that your schooling's done a lot different than it is for medical doctors and doctors of osteopathic medicine? You think that has a lot to do with how people kind of approach your industry?
I think that people don't really understand the schooling that we go through a lot of times. We actually spend much more time in an anatomy lab than medical doctors do, which, makes sense. They're not necessarily, most medical doctors are not like as hands on as we are, right? Um, so our schooling is 4 years after undergrad. It can be done in 3 years if you go straight through without taking a break in the summer. And so I think that's maybe something that people don't understand is you go to undergrad, you still have 4 years after that. I did an additional master's program that took another 2 years. So uh, yeah, I think hopefully it's changing that people will understand a little bit better what that looks like. But yeah, so I'm not sure. I'm not sure what that. It seems like the stigma of chiropractors is changing a little bit, anyways. As we're working more closely with PTs, especially, that used to be PTs and chiros used to be sort of at odds with each other. I'm sure they still are somewhere, but I work really closely with some great pelvic floor PTs, some just regular sports PTs that we work together with on patients, and share them and, send notes back and forth and really try to have the best, uh, like well-rounded healthcare team for the patient. And I work with a great set of physiatrists here, which a physiatrist is basically, I usually explain it to people like, because no one ever knows what a physiatrist is, a step between a orthopedic surgeon and me. So they're an MD, they do a bunch of orthopedic stuff, but they don't do surgery. So, I have been the team chiropractor for the Seattle Seawolves, our rugby team here, for the last 4 years. I took this year off, as I just had a baby, but we work really closely with them, and, that's been great too because we can all contribute to the health and wellness of patients, whether they're athletes or not, and we all can work together, and I think that's the most important thing is that all these different types of doctors can start to work together more for the benefit of the patient.
Yeah, and two, just to kind of add to your point, one, my brother's a physiatrist. So I'm
Yeah.
just laughing. I was like, he's a
Yeah,
DO. I was like, I know exactly what
yeah.
that is. And
Yeah, when I send people to them, no one ever knows though, so I'm always like, "Do you know what a physiatrist is?" And they're like, "For the feet?" I'm like, "No, no, not a podiatrist." So I just have my, like, spiel of explaining it down because I feel like I think they're such a great, healthcare provider that some people underutilize, so
yeah, and then the second point, which is just funny, is you talked about physical therapists, how you guys kind of had a stigma with them. Welcome to our industry. That's where we're at now. Physical
Yes.
therapists don't want to
Yeah.
talk to us.
Yeah.
So hopefully we can like do
Yeah.
the same thing and start working together, which is what I've been trying to do for the last 4 years, trying to break
Yes.
that gap.
I know, I'm always saying I wish we had. It's hard to find good personal trainers who have availability. A lot of the personal trainers here are too busy for us to send patients to, but there is that kind of gap between where someone like me as a sports chiropractor or a physical therapist sees someone and then gets them to a point where, okay, now it's time for you to get back into actual fitness, but you need someone to help you a little bit. You need that like stepping stone. And that's like perfect where personal trainers come in. But I know if you can get in with I mean, sports chiropractors, the PTs, like, we need you guys. If they don't wanna work with you, they're crazy.
Yeah, I think a lot of the times too, when like we have a policy, like if we have someone coming out of PT, it's when a patient comes in, and I'm sure you get this a lot. It's, oh, I did the thing, this thing.
Yeah.
I'm like, that's
Yeah.
so cool. I'm like, can you like let your PT know that you want to sign HIPAA forms and so we can see your program? Because that'd be great.
Yeah. Yeah. Yeah, totally.
So it's the same kind of like continuing it. If we can all work together and really teach the patient that we want to share your programs and do that, it really go a long way. I want to start tying though
Mhm.
into where your specialty is, which we've talked a little bit pre-show, and that's that postpartum. And that seems to be for the last this season, pre and postpartum have been like the main talking points for our
Yeah.
show. So it's just funny how like that seems to be the theme of season 3 for us. So
There you go.
postpartum is after pregnancy for people that may or may not know. After you give birth, what happens? A common thing we've talked about it happens to women is something called diastasis recti, which is the abdominal wall kind of coming apart. And it's important to note certain do's, don'ts for that. So walk us through for what that looks like for somebody coming to the chiropractic side of things and how you would treat it, because that's something we haven't talked about yet.
Yeah, sure. So diastasis recti, like you mentioned, it's a very normal, natural thing to happen during pregnancy. It has to happen, right? As the abdomen grows, the baby grows in there. It's like 99% of women. Some studies have even shown 100% during their pregnancy have diastasis recti. So I just say that because I feel like, it used to be no one knew what diastasis recti was. And now in the last I would say like 5 years, it's become this big buzzword, and if you look online, there's all sorts of people that are sort of fear-mongering about it a little bit, and so I always like to just clear that up that, like, it has to happen, it's very normal. The deal with it is we wanna just limit the movements during pregnancy that can make it worse, and it can make it harder to recover afterwards, and it's not dangerous to the baby, it's not dangerous to you, it doesn't hurt, it just if you do certain things during pregnancy, most notably, like, anything that is flexing the spine, so, like, a sit up, if you're in, like, the CrossFit world or HIIT world, like, toes to bar, kipping, like, that sort of thing. Even moving heavy weights over your head because you lose control of your core because it's so stretched out, that can also make it a little bit worse during pregnancy. So it's just avoiding some of those things and being mindful of them, making modifications, and then afterwards in the postpartum phase, finding someone to or whether it's online or whether it's in person, whether it's a like I said, a pelvic floor PT or a sports chiro, or I have an online postpartum rehab plan that I started during COVID because people couldn't come in and see me or see people as easily. Um, but finding something like that that teaches you how to re-engage your core, how to use your transverse abdominis, which is that big kind of flat muscle that wraps around the abdomen, and also use your breathing as a technique to help heal up the diastasis and just basically recreate tension so that you can be nice and stable through your core.
Have you seen women after having maybe more of like a severe end of it get full recovery? Is that something that can happen? If so, how long does that usually take? And what kind of program should those that have a worst case of it, I guess, what kind of approach can they take?
Yeah, so I definitely have, and what I always try to remind people is even if women aren't totally what we call like closing the gap, quote unquote, which is that gap between their abdominal muscles where those two rectus muscles come together, kind of the line of where six pack might be. Even if it doesn't close anatomically, what we're trying to do with them is close it functionally, which means you're teaching them how to create stability through their core by using their breathing, using their bracing, and using their entire core, right? So the pelvic floor, the diaphragm, and then thinking about the pelvic floor is the bottom of the quote unquote core, the diaphragm is the top, and then all the muscles surrounding, the abdominal muscles, the low back muscles. and really teaching how to re-engage those, because what happens is a lot of women become uh like you can't really connect to those muscles because they're so stretched out. So you have to be kind of like a reintroduced to them, sort of, and that can be done with breathing exercises, and then some really simple, specific diastasis exercises. I like to have people get in, especially if you're, like you mentioned, if it's an extreme case, quote unquote, like they have a pretty big gap, where they had more of a traumatic birth. I like to recommend people get in to see a pelvic floor PT or a sports chiropractor who specializes in postpartum care. And then, there's lots of stuff you can do at home. There's lots of exercises that you can follow along with. But I think seeing someone is important, because you want to there's so much tactile feedback, right? Like you need to have someone touch your transverse abdominis and say, here, this is what this feels like it when it's firing, and kind of walk you through that. So I always recommend that if possible. If not, like I said, there are some great online plans. There's some great online PTs, that have stuff out there, and yeah, there's a lot of work that can be done. I would wager to say no one cannot improve from diastasis after postpartum if they have the right training and they follow the right sort of guidelines.
Just a question that kind of popped into my head while you were talking. You pointed toward the transverse abdominis and said they're kind of engaging this muscle. Obviously, I've never been pregnant before in my life. So, do you lose that mind to muscle connection while you're pregnant? Or like, does that just
Hmm.
kind of disappear?
Yeah, totally. I mean, not all of your muscles, right? Like, but the abdominal ones for sure. Yeah, it gets really hard. I remember my first pregnancy. Um, I was on like an assault bike, so you're pushing with your arms and your legs. And I remember very distinctly, and it was around like, I don't know, maybe 28 weeks or something like that. But hopping on that bike, and you try to engage your core, right? When you're pushing, because you're pushing with your arms, you're pushing with your legs, you're trying to drive from your core. And I remember just like, oh, there's no core engagement here. This is like arms and legs from now on. And you just, because those muscles are so stretched, you do lose some feedback. And so obviously, that happens slowly over 9 months. So it doesn't come back right overnight once that baby comes out. So it takes some it takes some work, and it takes some understanding of what you're trying to do, to get back to a level of high fitness, especially.
And then the last question, kind of just related to this topic, is there anything pre and during pregnancy that someone can do to help prevent getting such a severe case of it, or maybe make
Mhm.
postpartum easier?
Yeah, a couple things. One thing is, just like with surgery, any surgery, they tell you basically the stronger you go in, the better your outcomes, right? So you don't, let's say you're going to have shoulder surgery, you want to keep strengthening the opposite shoulder. You want to keep doing as much as you can on the shoulder you're going to have surgery on, even, because the stronger you are going in, the stronger you will be coming out, and the easier, quote unquote, rehab will be, right? So same thing with pregnancy. Um, you want to be as strong as you can going in. So I always recommend, especially women that are trying to get pregnant or plan to get pregnant eventually, work on their glutes a lot, their posterior chain. Squat is really important for pregnant patients, and even, postpartum, really all around the perinatal period. I think squatting's super important. And so you can do that, and then during pregnancy, it's just limiting some of those movements, as I mentioned. So at some point, usually after the first trimester, is when I recommend people start evaluating whether or not they should be doing certain movements still. So lots of times they can do them, right? But it's looking at, I can do this, but should I do it? What's the benefit? What's the kind of cost benefit analysis of doing sit-ups, right? Like, am I really gonna make my abs that much stronger? No, but you might make it a little bit harder to recover later. So that's when we start talking about modifying movements, changing things up, and I always want women to keep working out during pregnancy. It's super important, but there's just different things that we can sub in for some of those movements that are harder on the ab muscles.
Yeah, I really couldn't agree more. And I want to dive a little bit more now, going kind of into the postpartum, how it affects your spine. I have a kind of a lot of questions just knowing obviously from watching from the outside. But we're going to take a quick break from our sponsor, guys, and we'll see you on the flip side. We'll be right back. For us, we know what it's like to feel unhealthy, depressed, and downright defeated. We want to show others there is a right way, and through fitness, you can do anything you set your mind to. Fitness can give you that motivation, confidence, energy you need to bridge that mental gap and prevent you from missing important life events. We understand it's about feeling better, living longer, and being good examples for our kids. We understand this because we live it. And for us, that's the redefined difference. Hey everybody, and welcome back. We got Dr. Karlie here talking all about postpartum. We're going to really dive into, I guess, a lot of things that I can say I observe in my industry, maybe not experience personally. So I guess I have a chock full of questions today, just kind of getting my brain moving on this topic. The first one I want to talk about, you give birth, right? That's a lot of pressure on your pelvis area, especially your hips. Is there a relationship between giving natural birth and having hip issues slash lumbar issues right after pregnancy, or maybe things that can continue later in life? Or is that just something I made up in my head?
I think it really depends. It depends on what the situation is going into the pregnancy. I do see if people have hip issues or low back issues going in, those don't necessarily go away, right? We have relaxin in the system that comes in. That's a hormone that's starts to loosen up the ligaments and the joints to give birth, but it doesn't loosen up just the pelvis. It loosens up all your joints. So if you have an issue, sometimes not always, but it can get worse. It doesn't usually get better with pregnancy. Um, and then it does take some afterwards. The relaxin is in your system until basically you're done breastfeeding, and so people sort of hope to feel better right away or think, okay, maybe a month or 2 or 3. But really, if you're going to breastfeed for, 9, 10, 12 plus months, you have to consider that things aren't necessarily going to be as stable as they were before. So that's what I see is really if there's an issue before, it doesn't necessarily get better, and it might take some care and rehab and strength building really postpartum to help with that.
Yeah, and I can imagine being pregnant, right? I see it a lot with just individuals. So I can just imagine it's 10 times worse when you're pregnant, especially like month 8. You're leaning back,
Mm,
trying to compensate with the
mhm.
weight. So that in of itself is putting a lot of pressure on your spine. What are some ways that specifically you can give advice to pregnant women right now to help not break their spines? And I know that was a little over
Yeah,
dramatic, but
yeah,
just in, you know exactly what I'm talking, just
yeah,
in general.
yeah, that, like, kinda sway back position, I think that's what you're talking about, right? Because the
Yeah.
belly is pulling so far forward, and so you get into that really big it's called lumbar lordosis, like, really, like, accentuated. So, what I usually recommend is they basically try to feel the extreme ends of both of those. So really tilt the pelvis so it's forward into that extreme kind of sticking the belly out, and then really tuck your bum under. And so you can feel what that feels like, and then meet in the middle. And that's like your neutral spine position. And so that's really important to find in general, right? But it's especially important for pregnant women because like I said, it gets so hard to feel what's happening through there. So I always recommend they try to find that. And then, really, if they're lifting weights and doing that sort of stuff, still really using that neutral position. The other thing that a lot of pregnant women do is they end up kind of really tucking their bum under and like tucking their glutes. And so I really try to teach them not to do that. And so that's sort of almost a compensation for that belly sticking out so far. And so that's where, remembering and learning to squat, learning to, doing some deadlifts, doing some glute work, all that gets really important and valuable because if you tuck those glutes under, that's now, changing the way that your spine is working, making you a little more unstable. So those are a few things that they can do right away is not tuck the glutes and then find that neutral position between the two extremes.
This kind of goes back to your original point about squatting, getting the
Yeah, I
glutes
know. I'm just like,
activated.
everybody squat. Yeah,
Everybody squat. Everyone get some hip thrust and glute bridges, please. Now, thank you.
totally. Yes. Yep.
My favorite exercises,
Exactly.
and that's a guy saying that. You never don't hear that often.
Yeah.
And then you give birth, right? You're in that postpartum stage. This is the look that I see all the time. You're carrying your kid, your hips tilted out to the right or the left, depending on what side they're at, and your
Mm,
spine's basically just totally L'd out. And I can only imagine the kind of pressure you're doing that. Is there advice to help? Like, hey, you're picking your kid
yeah.
up, maybe sit up a little taller. What's some things that we can help in that postpartum, especially with the young kids, kind of picking them up, carrying as opposed to your spine?
Yeah. Well, I'm glad you mentioned that because that actually ties in so well to um and maybe we can talk about it a little later, but this postpartum athletic brand that I have, it's called Jen and Carrie, and our motto is every mom is an athlete. And where that came from was basically what you're just describing of moms do crazy stuff, They're like carrying a car seat in this hand, a toddler on this side, a backpack on this side, and then they're like, walking the dog and carrying their coffee, and it's like that is so athletic. And so that's we came up with that slogan a couple of different ways. A, we want moms to be able to get back into whatever type of fitness they want, right? And and B, not just a mom, not that, being a mom is the most amazing job in the world, but there's so many other things too. And if an athlete's one of those, we want them to be it. But B, everything a mom does is athletic. So you think about putting the kid in the crib, right? Well, that's a hip hinge. That's a picking the screaming toddler up off the floor. That's a deadlift, right? So it just translates so well, the stuff in the gym to motherhood. And so that's where we say every mom, no matter what she's doing, is an athlete, right? And same thing as you're mentioning, that kid on the side of the hip, that's a hard position for the body to be in. So normally what I recommend is it's hard not to do that, but I recommend trying to switch sides. Most women hold their kid on their less dominant side so they can use their more dominant hand to do things, right? And so as hard as it is, trying to switch sides and hold on the other side. I also often coach women on how to use, especially if it's a smaller baby, how to use like a front pack, so that they can have their baby on the front of them and how to keep a nice neutral spine while they do that. Because then they have both hands free. The baby is more in line so they can keep a better position of their spine um, and their shoulders, because that's another thing is they're like, moms are rounded forward so much, holding babies, breastfeeding, doing all kinds of stuff. So that can keep them a little more upright using the front pack. And then just being aware of it, and trying to do some things to counteract, just like anything else we do in life, we try to counteract some of these poor movements that we do throughout the day with exercises in the gym, stretching, strengthening, that sort of thing. So, especially for moms, important to do some strengthening of like the pulling muscles. So, the lats, the rhomboids, the lower traps, everything on the backside, because they're so rounded forward and the pecs and everything are pulling so far forward. So that's where we try to really encourage some, and really who doesn't need strengthening of the pulling muscles, right? Our posture is so horrible as a society in general, but it's even elevated during motherhood with just everything pulling you so far forward.
Yeah, the importance of the posterior chain is something I drilled
Yes,
into everybody's
exactly.
head.
Yeah, totally, and I think people forget that the posterior chain is not just the glutes and the hamstrings, it's all the way up the back of the spine, all the way up the back. It's the whole posterior, not just the lower half. So, yeah, it's important to work on some of those muscles too.
I loved what you said. Moms are athletes because I just have this vision in my head. She has three kids. They're all screaming,
Yeah,
yelling. She's trying to deadlift one off to the right side while they're running away, grabbing the other by the shirt and trying to hold them. And the other kid's running. So she's running while doing all of this.
yeah, oh yeah, it's like not an uncommon scene, right?
This is why you need to keep moving into your lives so you don't end up hurting yourself. You see it a lot with especially kids. I can't tell you how many clients that come to us because they were chasing their kids and rolled their ankle. They're trying to play sports they're not good at anymore. They were picking their kids up, moving the wrong direction. They were taking your car seat and blew a disc. And these are just the most common injuries that we see. And it's usually right after having kids. And I don't know if you agree with
Yeah.
me on that one.
Yeah, often, yeah, and it's like just like we were saying, things are a little more unstable, and I think also sometimes people aren't like thinking so much about that, right? Because that's not like it's not like they're going and trying to like, deadlift 300 pounds. They're just trying to pick up a car seat. But even in my job as a chiropractor, it's usually the same thing, not always, wrapped around kids, but people come in all the time with a lumbar disc herniation and it's because they tried to put on a sock or because they tried to pick up a pencil. And it's like, that's not really the act that did it, right? It's like all these times before where you were rounding the spine or doing something, and that was just like the little straw that breaks the camel's back sort of thing. So I think it happens even easier in postpartum because things are now a little bit unstable. You have basically this new body. I tell all my moms that come back in after giving birth, I do a whole new evaluation on them. I set aside an hour of time because I'm like, you're not the same person anymore. You're not the same body. It's a whole new setup. So we need to like get a better, a new feel for it and see what you need now as opposed to how you were during pregnancy and how you were pre-pregnancy. It's a new body, it's a new person in a lot of ways, mental, physical, all the things.
Yeah, it's totally true. You're just a brand new person kind of coming out of it. And I love the fact that you're doing an extra eval with people because that really goes a long way. And I think the question I get the most is, you could be pretty brief with your answer, is how far soon should they get back to doing stuff and creating movement after giving birth?
Yeah, so that's a big topic. I mean, we could actually talk about that for, I could talk about that for hours, but I think one thing that I would love to stress to people is you can start some really simple stuff very early. So, some breathing exercises, some deep belly breathing, trying to get that diaphragm working again, some simple glute bridges, maybe, depending on if you had an uncomplicated birth. Some really simple stuff really early on. I started that stuff within 3 or 4 days with both of my pregnancies, um, and or both of my, after birth, and, you don't have to wait for that 6-week mark from your doctor to say, "Okay, now you can exercise." You can be doing a lot of sort of rehab stuff really soon. So, I usually like to recommend that to women, and the other thing about that is that it's nice to have something that you can work on because your body feels so foreign often, and so it's nice to have, "Okay, I'm gonna do these 2 sets of breathing exercises, um, some like hip hinging and some maybe like foam rolling of my glutes. And that's my little like workout, quote unquote, for the day. And you can do that without, worrying too much about it. So earlier rather than later with some of that, breathing and starting to work on a little stability, I think can go a long way.
Yeah, and just to kind of add to it, to those that say, well, I didn't give natural birth, I had a C-section. What would be your answer to
Yeah.
that one?
Yeah, so I actually had a C-section, with my second son. He was breech, and we couldn't get him to turn, that little sucker. So, he I had a planned C-section, and it's different for sure, right? You're having abdominal surgery. There was some stuff that I couldn't do that I could easily do after my first birth. But I think after, that week, the first week, your scar is pretty sore. It's pretty hard to move. The first 2 weeks, really. But you can still be doing the breathing exercises. You can be lying in bed doing breathing exercises. So I always recommend people start there. And then just, listen to their bodies. Don't try to rush things. And if you can get advice, help from, like I said, someone in your area that specializes in this, then that's usually the best way to go, so that you have someone who can kind of be on your team and help you through that process.
How do you feel about, after a C-section specifically, working the opposing muscles very, very, really, very lightly, obviously, but just kind of get those moving?
You mean as far as like opposing muscles,
Like
like
your
the
erector
low back
spina.
muscles or?
Yeah.
Mhm. Yeah, I mean, I'm all for it. The problem is the way that people do that, it's difficult to not put pressure on the front of on the scar. So, like, I was trying because of course, I'm like my own test case, right? So I was like, okay, now I had a C-section. I got to test out all this stuff. And so I tried to do some Supermans, I think at like week 2, and I was like, "Oh no, we cannot be laying on this scar yet?" So, I love for people to work some of those muscles, but it definitely you have to take into effect that scar. It's a little easier to work the glutes, like we're saying with like a glute bridge or something that like that, but even doing like a low back hold on what do they call it? Like off of a GHD or something, is too hard because there's pressure on the scar. So you just have to take that scar into consideration a lot of times.
Love that answer. Thank you. And I want to kind of go into what you mentioned a little earlier, which is the whole nursing, breastfeeding side. You were referring to your clothing company, but kind of why you started that a little bit. So obviously, this is something that I'll never have to do again. But how does that nursing side of it? You were mentioning with weightlifting, the way clothes are designed, they're not ideal for women who are athletic, and maybe that puts a damper on people who are breastfeeding, because at that point it's like, why would I do it if the clothes aren't made for me to do it? So kind of walk us through how that kind of started that idea and
Yeah.
the benefits of having this kind of sportswear as it comes to actually exercising.
Yeah, sure. So after my first son, the way the whole company started basically was my co-founder and I, she's a good friend of mine. She was over and asking how things were going, and I was just getting back into the gym and working out, and I was like, I just wish, like, I hate all these sports bras. I hate all these nursing sports bras. I hate the clips. I don't want these big zippers. I really love weightlifting. Like, I don't want to do a power clean and knock my bra off because there's this big clip in the way. I don't want to go running and have it come unclipped. So, anyways, we started kind of looking around at the nursing sports bra industry basically and could not find anything good. So we developed one, and it took a long time, and um, it took a lot of iterations, but we really wanted to create something that allowed women to get back into the gym, feel like themselves, and just be able to take that time to feel empowered and feel like the strong, capable, confident woman that they are. And, it's wonderful being a nursing mother, but a lot of these women have so many other things that they love to do and they want to get back to. And so it was a convenience thing. Like you want a nice sports bra that you can work out in, then immediately go to feed your baby. You don't wanna, like, be trying to rip off a sweaty sports bra, and there's a crying baby, and it's, like, a whole thing, right? Um, but B, we just really our goal at Jen and Carrie is to empower women to get back to whatever activity it is that they love and trying to, in any way possible, make that easier. So basically, what we did is we made a sports bra that looks exactly like a regular bra. It has a different technology, so it pulls up from the bottom and then pulls down from the top. So to especially to someone who isn't nursing, someone like maybe you, Anthony, you'd never know that it's even a nursing bra. You just think like whatever, like Shelly's in her sports bra today. And that was our goal. We had a couple of friends that don't have kids, and they were like, we had them try it on and see how it fit, and they're like, yeah, it just looks like a regular bra, and we are like, yes, that's what we want. Like, you don't even know, you just said the right thing. So that's kind of where it stemmed from. Is me not having the tool that I felt like I needed and wanted to just make getting back into athletics, into fitness, into working out, and feeling a little more like myself to make that more possible.
I love that. Very, very good vision and model. So that's really something I
Yeah,
recommend
thank
people got to
you.
check out. I have a nursing question, just
Yeah, sure.
curiosity. Is there a certain, does your metabolic rate increase? And if so, how much? Because I've always been told that it does, but they've never really
Mm.
explained beyond that. Is that active breastfeeding? Is that in general? Like, what does that look like?
Yeah, that's a great question. I wish I had a number for you, but I do not know exactly what that increase looks like. I can tell you that it does increase, just like during pregnancy, because you can imagine you're creating something from not from nothing, but something that you weren't creating before, right? So you're creating a baby, and then you're creating breast milk constantly. So that's where, it's super important to stay really hydrated. It's super important to be eating enough calories. Um, and if you don't do those things, you do see that drop in breast milk production. So yeah, definitely the metabolic rate increases. And you can ask any nursing mom. She's like, I'm so hungry all the time. um, and so, that's anecdotal, but I don't know the number. I don't know exactly what that looks like, but I do know that is true, that it does increase. So it's important. I always stress it's so important to be. A lot of women will get kind of hung up on wanting to get the baby weight off, that sort of thing. And like, there's lots of time for that. I always just try to stress like, you have to eat, you have to be nourished, you have to be not just eating crap, but like getting your nutrients in so that you can nourish your baby. And even if they choose not to breastfeed, or some people, try to breastfeed, it doesn't work. There's all sorts of stories, things that happen. Even if women don't choose to do that or aren't able to, it's still important that they're nourishing their body, right? Because they're still recovering from giving birth. They're still recovering from losing a lot of blood. And so there's all these things that it's just important for that during that postpartum period that they're really nourishing their body, whether they're breastfeeding or not.
Yeah, and I think just kind of understanding that it's milk, right? Milk is a heavy in proteins and fats. So I can only imagine
Exactly.
that's kind of what your body's craving, is fueling it with the proper types of fats, so meaning more of an unsaturated form, as well as
Hmm.
increasing your protein intake. And higher
Yep.
amounts of simple carbs probably aren't going to matter too much because that's what you use to make the milk. Is that a good understanding?
Yeah, that's pretty good. Yeah, and it's always important to try to get, and it's hard, I think, to get enough protein. So that's where you start looking at, okay, we can't just think about our protein as, just eating meat, right? We have to start looking at our whey protein, maybe doing a shake or whatever type of protein, shake protein that people can tolerate. We have to start thinking like, okay, what other sources of protein are there? There's tons of vegetables. Peas are really high in protein, obviously. So looking at like, okay, how am I getting these nutrients, and not just thinking like, because who wants to just be like chomping on turkey and chicken all day, like there's other ways to do it. Yeah, okay, maybe you. Um, um, but there's other ways to do it, I think, especially during that time frame of like, we can add collagen to things. There's, lactation cookie recipes that you can make that are healthy, that there's all kinds of ways to do that. So, I think it's getting a little bit creative and not just getting out of the mindset of like, okay, I just have to crush chicken all day. That doesn't necessarily sound so good to a newly postpartum nursing mom, but there's other ways to do it.
I think I'm going to redo my protein episode I did 2 seasons ago about what to intake and add this postpartum side to it. Because now that I've learned a little more about it,
Yeah.
increasing the amount of protein, and maybe we bump that general like zero point 0.6 per pound that we have usually for females up while you're breastfeeding to maybe that like zero point 0.8 realm.
Hmm.
We usually see some med sitting. So I love that. I recommend you guys go back and check that episode out. You'll learn all about BCAAs. What are the essential ones that your body already doesn't produce, the non-essential ones that we already do produce, understanding that if you're not eating animal products, you're not getting complete protein. So learning how to balance things together, like rice and beans is a complete protein if you're putting them together. So those things are already naturally made. So I do love that. And I'm just happy we're like trying to walking through this, because I got a lot of females that I train coming out of pregnancy. Now I can be like super more confident with them. Like, this is exactly what your body needs to work on. I guess the last nursing question I really have in general is alcohol and smoking. I mean, maybe not so much smoking, but more alcohol, more things you're putting inside your body. Does that leak into breast milk? Could it? I really don't know, and I'm going to let you answer that one.
It does, yeah. I think the, kind of standard understanding is that, like, it's like 10% of what you intake can go into the breast milk. So, I believe I haven't looked at that for a little while, but I believe that's the percentage. So, it's a really small amount, right? Most It's interesting because people have very different takes on this, and it depends on what country you're in, because in Europe, tell a French woman in France or an Italian woman, not to have their glass of wine during pregnancy. They do it all the time, and here we're very, anti-alcohol during pregnancy, during postpartum. And so it really depends on who you're asking, on what country you're in, and what your comfort level is. We can't do testing on pregnant and postpartum women, with their babies. So we can't do double blind studies, obviously. Um, and so in America, we've gone the most conservative route and said no alcohol during pregnancy, during postpartum if you're nursing. Sort of the standard there is the most understood, safest time. Like, let's say if you're going to have a glass of wine and you're nursing, is actually while you're nursing, because by the time your body is processing the alcohol, the baby has done nursing, and so then that's your body's kind of processing through that. Um, but again, like, it just depends on who you ask, what your doctor says, and what your comfort level is. So, um, there's a book that I really loved. What is it called? I read it during, I think, Crib Sheet. I read it during my pregnancy. And oh no, it's not Crib Sheet. It's her other book. Crib Sheet is the second one. Anyways, it's a great book basically about this economist who does all this research on these topics, right? It's like, can we eat lunch meat during pregnancy? Can we eat sushi? Can we drink alcohol? And so it's all these, as much study as there is out there, kind of combined together, and what the research actually says. So that's not my area of expertise, of course, but that's a good resource for people to look at, um, if they have more questions on that. It's called Expecting Better. That's what it's called. And the author is Emily Oster, I think.
Awesome. Definitely something you guys should go check out. And then is there anything else you want to add to this postpartum before we wrap the show up? So are there other things you see often as a chiropractor with women that are breastfeeding, that are postpartum? Anything else you really want to throw and say, hey, this is something I see often, maybe do this, do that, not that kind of deal?
Yeah, one thing, especially maybe for personal trainers actually who are working with this population, one thing that I do see a lot is it's called mommy wrist, or people will start to have pretty bad pain in their thumb or in their wrist, and it's from holding the baby, in this position a lot. Everything again being rounded forward. So people can also start to have some elbow pain with that. So one thing that I often recommend people do is do some strengthening of those forearm muscles, starting during pregnancy and then continuing into postpartum. The wrist rollers, however you like to strengthen those muscles, that can be super helpful. That eccentric, concentric loading of both the flexors and the extensors of the forearm. That's one thing that takes a lot of people by surprise is, sometimes women are expecting, okay, some pelvic pain, some low back pain, even upper back pain from nursing, but the thumb or the wrist pain really can take people by surprise and can be really extreme, and 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 limiting if not taken care of or addressed properly. So that's one thing that I always try to mention and have people work on in advance, just because that's one problem you can avoid pretty easily with the right exercises.
Really good to know. Thank you for that. It's definitely something we
Yeah.
can focus more on. Love the kettlebells for forearm strength because
Yeah.
of the imbalance of them. Super fun. But I'm going
Yep.
to ask you the same two questions I ask everybody at the end of the show. First one is if you could wrap this show up in one or two sentences, what would be your take home message?
Yeah, I know, I hear you ask this question, I'm like, "Oh, that's tough, man." Um, yeah, I think for me, it would just be, our motto that every mom is an athlete, and, my goal in life really is basically to empower women in that postpartum time, and if there's any way that I can do that, I'm happy to have people reach out to me so that I can be of assistance.
I love it. And then the second question, you probably know exactly what I'm going to ask. How do people find you, get a hold of you, give us all the good stuff? Go for it.
Of course, yeah, yep. So online, of course, our website is jenandkerry.com, Jen and Keri. Funny story on that is that the reason our company is named Jen and Kerry is my name is Karlie and my partner's name is Jess, and no one ever gets our names right. They always call her Jen and they always call me Kerry. So Jen and Kerry is our like pseudo, pseudo names of like your fun mom friends who know all the things. Sort of backfired now because everyone calls us Jen and Carrie like even more because now we've like named our company that. But anyways, online there, also on Instagram, Jen and Carrie. And then I'm on Instagram at Dr. Karlie, Karlie, and also online at karliecausey.com. So that's the easiest ways to find me.
I love it. And I love the company name. We're just laughing about that. It's hysterical. And thank you guys for joining
Yeah.
us on this week's episode of Health and Fitness Redefined. Don't forget, hit that subscribe button and join us next week as we dive deeper into this ever-changing field. And remember, fitness is a journey, not a destination. Until next time.